So yes, at this meeting, we present results of the final analysis of the CLL11 study. Here are my disclosures. And as you all know, chronic lymphocytic leukemia is a disease that primarily affects older people, and the purpose of that trial was to improve the treatment of these elderly CLL patients with comorbidities by introducing immunochemotherapy, because chemotherapy alone was the standard treatment at the beginning of the trial. Another goal was to compare obinutuzumab, that is a type 2 glycoengineered CD20 antibody, which was new at the launch of the trial, with rituximab, broadly known type 1 antibody targeting CD20. So this was the trial design. This was a randomized phase 3 trial, and as already said, the trial recruited around 800 patients who were older. The median age was 73 years, and who carried a significant burden of comorbidities. And then we had a 3-arm design here with a common comparator, which was chlorambucil monotreatment. And then we had the combination of chlorambucil with rituximab and the combination with chlorambucil with obinutuzumab in that trial. And we had PFS as a primary endpoint and 3 pairwise comparisons in this trial here. So the primary analysis was already done 5 years ago and actually presented at EHA here in Stockholm in 2013. There was also an updated analysis 2 years later. Basically, these analyses showed superiority of chemoimmunotherapy over chemotherapy alone with regard to PFS. This was true for obinutuzumab and rituximab, and also overall survival, which was only true for obinutuzumab. The trial for the head-to-head comparison of the 2 antibody arms also showed superiority of chemoimmunotherapy with obinutuzumab when compared with rituximab with regard to progression-free survival and time to next treatment, but not overall survival at that time point. Now we have run the final analysis last year after closing the trial. We now have a median observation time of 5 years, and the results, to say it briefly, robustly confirm previous observations. We also did not see new safety signals. And importantly, in this analysis, we could demonstrate a statistically significant and also clinically meaningful overall survival benefit of obinutuzumab over rituximab when combined with chlorambucil in this patient population. I briefly flipped through 3 Kaplan-Meier plots to illustrate this. So this was a primary endpoint, progression-free survival here. As you can see, the PFS superiority of obinutuzumab over rituximab was confirmed here with a nearly doubling of the median progression-free survival. And this benefit translated into a clinically meaningful prolongation of the time to the next anti-leukemic therapy. Again, this was virtually a doubling in the median time to next treatment in favor of the obinutuzumab arm. And these are the overall survival curves for this recent analysis. And as you can see, this final analysis of the CLL11 trial now demonstrates a prolongation of overall survival in the obinutuzumab arm compared to the rituximab arm. The median overall survival in the rituximab arm was 73 years, whereas it was not reached in the obinutuzumab arm, and the hazard ratio was 0.76. We consider these results clinically meaningful and also remarkable in the context of the long follow-up of the trial. So we conclude from these data that in the present treatment landscape of CLL, we think that these data support the use of obinutuzumab and chlorambucil as a frontline therapy in patients with CLL who are old and have comorbidities. If one decides for a chlorambucil-based chemoimmunotherapy in these patients, we think that these data strongly suggest to use obinutuzumab and not a type 1 antibody in this setting. We also think that these data reassures the choice of using obinutuzumab chlorambucil as a valid comparator arm in ongoing trials, testing new treatments in this vulnerable patient population. And finally, as you all know from these trials, there are new combinations being tested, and these data is a good basis. Suggests obinutuzumab is a preferred CD20 antibody for future combination regimens in CLL. Thank you for your attention.